we should understand that infertility itself causes some amount of depression. More than calling it depression, we just have to say it's a state where the patient is desperate, they are anxious, it's a mix of emotions. It's not a very easy thing to go through.
Hello and welcome to Doctor Story, everyone. Today we are going to gain an insight about the two most common infertility treatments, IVF and ICSI. These are a method of fertilization that takes place outside the body in a laboratory dish. And for this, we have invited Dr. Roshni Rohit, MBBS and MS OBG, the director of R&R Hospital, Chennai. She also holds a diploma in assisted reproductive technology from Germany. She did her fellowship in minimal invasive surgery. She's been practicing for the past 10 years now, and she says her life's purpose is to make women's healthcare affordable and to create awareness for different issues affecting women's health. Dr. Roshni, it's an absolute pleasure to have you here. A warm welcome to Doctor Story.
Thank you.
So, doctor, let's begin by understanding the diagnosis for infertility. What are the different tests for evaluating infertility?
So when a couple comes to us, the test again depends upon the age of the couple. And we have certain tests for the male partner and certain tests for the female partner. The most common test that we do for the female partner will be on the day 2 of their cycle. We'll ask them to come on day 2 of their periods, and we will do a few hormone tests. Like we will check their anti-Mullerian hormone, their FSH, LH, their thyroid, their regular tests such as their hemoglobin and their sugar levels. And we also do a scan which is called as AFC, antral follicle count. Now in that scan, we see the number of follicles that are ready to become a dominant follicle in that particular cycle. So we expect to see at least six follicles in each ovary, which means it's a good ovarian reserve. And in the male, of course, the first standard test we do will be the semen analysis. Now, based on the semen analysis report, we do further tests such as examination by a male doctor. And we'll also do an ultrasound, if necessary, of the testis and the scrotum. And we also do certain hormone assays if we find that the sperm count is really less. And also we check for regular tests such as CBC, your thyroid, and your sugar levels in both the partners. So superficially, these are the basic bare minimum tests that are required for us to approximately understand what is the issue for the couple to get pregnant. And one more test that we do would be, we check whether there is any block in both the tubes. So that is done by either an ultrasound in the female, is known as canine sonogram, or you can do something called as HSG. So it will let us know if there is any block in the fallopian tubes or not.
Okay.
So these are the basic tests.
All right. So if we talk about the procedures, how long are these procedures for male and female differently?
So we're going to talk in terms of blood tests. It takes 20 minutes. You just come in empty stomach, you give the blood test and you leave. And say you come back for an ultrasound, that will take about an hour. So to evaluate a couple, it will take us any time between like 2 to 3 days, including getting the test results, as well as counseling the couple and telling them where exactly there is an issue.
All right. So is there any fertility test that can be administered at home?
See, the only thing that you can do at home would be to check whether you're ovulating or no using an ovulation kit. So it's widely available in the market. You can order it online. So what we do is, once we get the kit, we, from say day 12 onwards, every alternate day, we ask them to check. So if they get 2 lines on the kit, that means they are ovulating. This is another method we tell for couples to try at home. So they are trying at the time when they are ovulating. If they are not getting lines on it, that obviously means that they are not ovulating that month. So that's the only thing you can actually do at home.
Okay, all right. Coming straight to the treatment options that we have, IVF and ICSI, wherein for the audience, IVF is in vitro fertilization and ICSI is intracytoplasmic sperm injection. Please elaborate on each of them and help us understand in detail.
So in case of IVF, you see, we choose that for people where their female fertility is the issue. And ICSI is chosen when the sperm is the issue. Male factor is the problem for conception. So in layman terms, if I have to tell you what is the difference between both. So in IVF, say this is the egg which we have taken from the female. The sperm is poured over the egg and the best sperm will enter the egg and it will form an embryo. More like a natural selection. But in an ICSI, the best sperm is taken, the best egg is taken, and both the fusion is done under microscope. So the chances of error, whatever is possible, we reduce it over there. But basically speaking, IVF is for when the female fertility is an issue, and ICSI is when the male fertility is actually the problem. Now, when it comes to the procedure, the stimulation, that is from day 2 of periods, the injections that we give, the egg that we take, that is called as oocyte retrieval, the embryo that we form, and then the embryo transfer we do, everything remains the same. Only difference is how the egg fuses with the egg. I mean, how the sperm fuses with the egg is the difference in the procedure. And usually, if you see cost-wise, you will have a difference of about, in Indian rupees, you'll have a difference of about 20,000 to 25,000 rupees is the difference between an IVF and an ICSI. You pay that extra for that one procedure alone.
All right. So if we talk about ICSI and IVF differently, what do you think? ICSI is more successful than IVF? What's their success rate?
If you look at overall success rate of IVF or ICSI throughout the world, it is somewhere between 40 to 50%. That is the actual success. But again, suffers from center to center and individual to individual. But currently, if you see, most of us are practicing ICSI over IVF because on a case-to-case basis, we do see more amount of success rate in ICSI. But if you base it on evidence-based study says there's actually not much of a difference in it. But on a personal experience, if you ask me, I find my success rate with ICSI are better than just doing a regular IVF.
Mm-hmm. All right. Now, if when we dwell deep into such procedures, we often are dreaded with the risk attached to such procedures. If you could shed some light there also.
Okay, so as you know, it's purely hormone injections. And we are giving high dosage of hormone injections. Now, there are different ways to do ICSI. Now, one thing is, say we start a cycle. There's something called as fresh cycle. There's something called as frozen embryo cycle. So when we do a fresh transfer, that means the same month when the egg is removed, the embryo is formed, and after 5 days, it's kept back in the patient. When we do a frozen embryo transfer, the next month after the period comes for the patient, we start preparing the endometrium and we keep the embryo. Now, the advantage of this is it gives some time for the hormones to wash out of your body. And secondly, we have seen there's actually a little bit of increase in success rate in frozen cycle, then your fresh cycle. And second thing is for a patient who is consistently on drugs. I'm not talking only about ICSI because nobody starts with ICSI for infertility. They will start with basic medicines, then they'll be on hormones for some time, and then they will do ovulation induction. After that, they will do IUI. So, the patient will be on treatment for 3-4 months, 3-4 years also in some cases before they come to us. So when you are on constant, exposure to hormones, yes, we do have side effects. There is at least a minimal increase in chances of having a uterine cancer. There's a minimal increase in the chance of having breast cancer, obviously after the age of 40-45. So for people who are on repeated treatments, we do ask them to get examinations done once a year once they cross the age of 35. Secondly, there's a lot of weight gain, mood swing, there's acne, there is hair loss. And we should understand that infertility itself causes some amount of depression. More than calling it depression, we just have to say it's a state where the patient is desperate, they are anxious, it's a mix of emotions. It's not a very easy thing to go through. And with the hormones, I think they're just heightened in their emotions. So we do find their emotional state to be more vulnerable when they are on medicines. I have seen that in some of my patients. Either they become extremely angry or they start everything. We have seen both extremes. But these are all short-term side effects. See, the mood change, weight gain, and all, once they go off treatment, they'll be fine. But I would like to say that you should not try for more than 4 cycles of IVF or ICSI on any women. And if you are going to try, we should leave a gap of at least 3 to 6 months between the cycles. Now, when you have a back-to-back cycle, obviously you're exposed to hormones a lot over a short period of time. There's bound to be some side effect or the other.
True. So what if there's a fertilization failure with IVF or ICSI? What's the next available treatment?
Okay, so nowadays we do have quite a lot of things. Now, when you say failure, we have to see why we have failed. Say, is it because the sperm quality is bad? The sperm quality is bad. Usually with ICSI, we do get a better success rate. We have to see whether the implantation is the problem. If the implantation is problem, we have a test called as ERA. So once we do that ERR test, what happens is we'll realize on which date we're supposed to keep the embryo for the uterus to accept it. And then there's a procedure called as BAPSI. Now what BAPSI does is like a PRP. Patient's blood is taken, it is centrifuged and given back. We put that into the uterus before the embryo transfer. So that will help in the endometrium being more richer and accepting the embryo. And say nowadays, it's still an experimental procedure. If the egg quality is actually the problem, there are some of them who are trying PRP on the ovary. So they do PRP on the ovary, where it's injected, that PRP injected into the ovary. We let the patient stay for 3 months. And in some cases, yes, we have seen better quality of eggs coming out. And then there's something called as an embryo glue, and there's something called as laser-assisted hatching. So there are a lot of advances in IVF and ICSI which we can try before we come to a conclusion that nothing more can be done for the patient.
So lastly, doctor, if we have so many options, I would like to ask you, what's that one situation where you declare the couple that they won't be able to become a biological parent?
So for me personally, the age of the patient matters a lot. Because the older they get, even if you are able to form an embryo, there are chances of autism, ADHD, and other issues. Again, you do have couples who have chromosomal abnormalities. That is, if that person's sperm and this person's egg is going to fuse, they do end up forming embryos which have some defect or the other. That's another point. Third thing is when there is no sperm in the male partner. We do have couples where the husband has 0 sperms. And then again, when we have women who have a very weak uterus or who have a huge ovarian mass or a fibroid, which even if we treat, we feel that the pregnancy will not be taken to term. And again, there are some women who do have issues in the egg itself. So the egg that we remove from them will have some defect and they will not be able to form embryos at all. So these are few of the cases where we cannot help them to have their own kid. But in today, there are options where you have donor embryos. So if the pregnancy is what the patient wants to carry to term, we have donor embryos. And if they still want a biological child, and if the husband's sperm count is good, we can always go for a donor egg, form the embryo, and implant it in the female partner, so that when they give birth to the baby, it's at least 50% biologically theirs. So these are the options which we can give to the patient. And yes, there are options of surrogacy in couple who are, the woman is already 44, 45. For her to take the pregnancy will be life-threatening. So in countries where surrogacy is legally allowed, we do ask them to opt for it once they cross the age of 40.
Well, you have been sharing such a complex looking procedure in such simple terms. We can't fathom how many couples would benefit out of this video. We totally appreciate the time you have taken off for this video. Thank you so much, Doctor.
Thank you. Thank you for the opportunity.